Now talking about peptic ulcers, and we learn about some information about them. First, what is the peptic ulcer disease? Peptic ulcer disease is an ulceration in the stomatoduodenum resulting from an imbalance between mucosal protective factors and various mucosal damaging mechanisms. Etiology of peptic ulcer diseases. Etiology of peptic ulcer diseases. The following are common mucosal damaging factors. Helicobacter pylori infection. H. pylori is the major cause of peptic ulcer disease. It is found in more than 70% of patients with duodenal ulcers and gastric ulcers in the United States. Medications. Incompetent pylorus or lower esophageal sphincter. Bile acid. Cigarette smoking. Alcohol. Antagonist that inhibits. Cimetidine is a histamine A2 receptor antagonist that inhibits stomach acid production. It is available over the counter and is mainly used in the treatment of heartburn and peptic ulcers. Mechanism of action. Cimetidine is a drug that blocks the production of acid by acid-producing cells in the stomach and can be administered IV and orally. Cimetidine belongs to class of drugs called H2, histamine 2, blockers. Histamine 2 antagonist, H2 blocker. Stimulation of acid secretion in the stomach requires activation of histamine type 2 receptors, gastrin receptors, and muscarinic receptors. Cimetidine and related H2 blockers inhibit the action of histamine on the secretion. Cimetidine increases stomach pH to help heal and prevent gastric and duodenal ulcers. Interaction with cimetidine. Amiodarone interaction with cimetidine and increased serum concentration. Citalopram interaction and increased serum concentration. Use of alternative H2 antagonist or adjustment of citalopram dose recommended. Warfarin increased international normalized ratio. Cimetidine effect is dose-related. Beta blockers. Effects may be increased, except with atenolol, betaxolol, bisoprolol, nadolol, and butylol. Contraindicated. Cimetidine is contraindicated in patients with no hypersensitive to the drug. Cimetidine should be used cautiously in geriatric patients.
Hello. My name is Ahmed Fuad and we are going to talk about an important drug in treating the peptic ulcer disease. I hope that you will like my work and I hope also you overlook my mistakes as it is my first time to do such thing or that pachikuncha. We will talk about prenizepine. The dose. This medicine is taken orally as prescribed by the doctor and often 2 to 3 times a day. The best way to give it is before 1 to 1.5 hours with a cup of water. Do not increase the dose or take more doses than usual, you will not get better faster but the risk of side effects may increase. Mechanism of action: The drug is a muscarinic receptor antagonist that binds to receptor of the muscarinic acetylcholine. That receptor allow many cellular responses like adenylate cyclase inhibition, phosphoinositides breakdown, and also potassium channels modulation throughout the action of proteins called G proteins. It has no traces on the brain and spinal cord because it cannot spread through the blood-brain barrier. Prenizepine can react with phenanthrolin which lead to decreasing the prenizepine's medical effect. It also interacts with vomoclidinium and that interaction increase the drug's side effects. Prenizepine anticholinergic activities can be increased when taken with atropine. Contraindication: People who known to have asthma or allergy are in risk of reactions from the drug, so the doctor have to know the history of the patient's allergy before starting the treatment. The signs could be hives, skin rash, and itching. Of course, an individual ought to not take the bismuth on the off chance that there has been a past response to this drug, aspirin or any other medications of salicylates. If this treatment causes you to feel sleepy or confused, be careful when driving or doing attention-taking work. This treatment should not be used during pregnancy unless necessary. Discuss benefits and caveats with your doctor. The appearance of this medicine is not known in breast milk, so consult with your doctor before breastfeeding. Problem with prostate. Heart failure.